Good afternoon, everyone. We are Group 5 and we are about to report trematodes. What is trematodes? Trematodes are also known flukes. They are worms that possess a primitive digestive tract. Flukes are fleshy and a leaf-shaped worms. They may be hermaphroditic or dioecious. It means that it is reproduced via separate sexes. Most flukes are hermaphroditic except for Schistosoma species. Trematodes is divided into two classes, which is the blood-dwelling flukes and the tissue-dwelling flukes. Sa blood-dwelling flukes, we have only one, the Schistosoma species. And sa tissue-dwelling flukes, we have Clonorchis sinensis, Fasciola hepatica, Paragonimus westermani, and Fasciolopsis busci. First, we have the blood-dwelling flukes, which is the Schistosoma species, and it is categorized by three: the Schistosoma japonicum, Schistosoma mansoni, and Schistosoma hematobium. Blood flukes are dioecious, and it is known as romantic parasites because of the male and female are usually in the stage of copulation. Female worms are usually larger than male worms. The schistosomes are also obligated intravascular parasites. The source of infection of Schistosoma species is the larval forms of parasites released by freshwater snail. The mode of transmission is through skin penetration by the fork-tailed cercaria, and the characteristic manifestations include chills, abdominal pain, cough, bloody diarrhea, and weight loss. And Schistosoma species intermediate host is the freshwater snail.
Paragonimus westermani or oriental lung fluke is type of trematodes. Like the other trematodes, the mode of transmission is through ingesting the second intermediate host, which is crab or crayfish, containing the infective encysted metacercaria. If ingested, the larva will enter the small intestine, then migrate into the walls of the small intestine. It can pass through peritoneal cavity, then to the diaphragm until it reaches the part of the lung. Then it can damage the parenchyma. Then the adult form will mature in the lungs. The adult worm will enter the bronchioles and are then coughed up or swallowed. The eggs in the sputum or feces reach fresh water, then it will hatch and penetrate the first intermediate host, where they differentiate into free-swimming cercaria. Then the cercaria will leave the first intermediate host, and it will now insist on freshwater crabs, which is the second intermediate host. This is the one who's ingested by humans. In epidemiology and pathogenesis, this is common in Asia. Reservoir hosts, we have pig, monkey, other animals that eat crayfish and crabs. Adult worm exists in fibrous capsule within in the lung near the bronchioles. It may form a cyst in the bronchioles. It has blood stain with purulent material containing eggs. This may cause secondary bacterial infection. Laboratory and diagnosis in characterizing the egg of Paragonimus westermani. They can be present in sputum and feces. Also in chest X-ray, it may show a ring-shadowed opacity with several contagious cavities and appearance of cluster of grapes. The adult worm has thick, fleshy, has a coffee bean shape. When fresh, it is reddish-brown in color. It measures 8 to 12 mm in length by 4 to 6 mm breadth and 3.5 mm thickness. Oral sucker is situated at the anterior end of the body, while ventral sucker is at the middle of the body. The egg is golden brown in color, oval in shape, and provided with Flattened opercular opposite is thickened abopercular portion. It measures 80 by 55 mm and are immature when oviposite. This is the life cycle of Paragonimus westermani.
So now let's move on to the Fasciolopsis busci or the large intestinal flow. The eggs of Fasciola hepatica and Fasciolopsis busci is morphologically identical. They only differ in size. The adult worms of both parasites also similar, except shoulders, wherein not present in Fasciolopsis busci. First intermediate host is the snail, and the second intermediate host, edible aquatic plants. So the transmission is through ingestion of raw or inadequately cooked aquatic vegetation carrying encysted metacicaria. The metacicaria exists in the duodenum and attaches to the intestinal wall where they attain maturity. The adult worms lay eggs released together with feces into water where they hatch and infect the first intermediate host. Eggs develop into cercaria, which insists as the metacecarion on the surfaces of aquatic plants, which is the second intermediate host. The other animal reservoir hosts include pigs and dogs. Fasciolopsis busci is the largest intestinal fluke that can infect humans, wherein this infection is common in Asia and India areas, particularly where pigs are raised and freshwater aquatic plants are ingested raw. There's no locally acquired cases in humans or reported in the Philippines. The pathologic changes are due to damage to intestinal mucosa by the adult worms. Fasciolopsis, most infected persons are asymptomatic. However, heavy worm burdens, patients may experience abdominal discomfort with inflammation and bleeding in the affected area. The ulceration may occur and mimic symptoms of duodenal ulcer, and patients may also suffer from malabsorption. The intoxication may result from absorption of worm metabolites by the host, leading to allergic symptoms like edema of the face, abdominal wall, and the lower limbs, while the profound intoxication may result to death. The diagnosis is made by demonstration of eggs in the stool specimen. The examination of bile and duodenal spirate may differentiate it from Fasciolopsis busci eggs from those Fasciola hepatica. The drug of choice for treatment is praziquantel, or the alternative is the niclosamide. So to prevent and control this Fasciolopsis busci, adequate washing and cooking of aquatic plants before consume can help. So the other measure include proper disposal of human waste, control of snail population, and prompt treatment of infected persons.
Fasciola hepatica, also known as the common liver fluke or shift liver fluke, is a parasitic trematode of the class Trematoda, phylum Platyhelminth. It infects the liver of the various mammals, including humans. The disease caused by the fluke is called fasciolosis or fascioliasis, which is a type of helminthiasis and has been classified as a neglected tropical disease. Fasciolosis is currently classified as a plant food-borne trematode infection, often acquired through eating the parasites. Yes. Fasciola hepatica, which is distributed worldwide, has been known as an important parasite of sheep and cattle for decades, and causes significant economic losses in this livestock species. Because of its relatively large size, the economic importance, it has been the subject of many scientific investigations, and may be the best known as any trematode species. Fasciola hepatica's closest relative is Fasciola gigantica. These two flukes are sister species. They share many morphological features and can mate with each other.